Hi, my name is Katie. I'm an emergency department nurse from Pennsylvania. While working in the emergency department, I've learned that interdisciplinary collaboration is extremely necessary to provide optimal care. Situations happen so quickly in this environment. Our team must be working together in harmony, or things will get delayed, errors will occur, and potential lives can be lost. Every shift cannot go perfectly, but because of that, lessons can be learned and we can prevent matters from reoccurring. Within this video, I will talk about a scenario that occurred while I was working that had both positive and negative outcomes. I will also explain how poor collaboration can lead to inefficient management of both human and financial resources. Next, I am going to identify leadership and collaboration strategies that can improve a team's ability to achieve their goals. After going over the scenario that I encountered, I will then speak about the Villa Health activity. I will discuss ways that this company didn't communicate effectively and address how their human and financial resources are affected. I will include one leadership and one collaboration strategy that may benefit this team and their desires. The scholarly resources that I use to research interprofessional communication will be mentioned and provided in a separate document. Because of this assignment, I am now always looking for what was done well and what needs to be fixed throughout my shifts at work. The scenario that I chose to discuss was a particular cardiac arrest, also known as a code in the ER. The patient was a 67-year-old male, witnessed arrest from home. His status was pulseless electrical activity, also known as PEA, on arrival. The first responders placed an IV in the left antecubital and one in the interosseous line in his right leg. Before he arrived to the ER, EMS called in to make sure that we were aware that they were on the way with an arrest. Our team set up additional IV materials, the machines needed, and contacted the respiratory department. The crash cart was already in the room, and it was our trauma room. When EMS arrived, they came straight to the room. On transfer of the patient from their gurney to our stretcher, the patient's peripheral IV got yanked out. The room was very loud, and no one heard the nurse say, "Watch his line." Now blood was spilling out everywhere, and the team was frantic to get another IV. I also noticed upon transfer that there were no defibrillator pads ready on our crash cart. Someone must have used them earlier that day or forgot to check the cart's supplies in the morning. We sent a tech out to find a set of pads right away. The team was still yelling about the line being lost. I heard EMS say, "Are you kidding me? That was a perfect line." Then the charge nurse yelled, "You need to hurry up and get another IV." This put a lot of pressure on the RN trying to get another line. Speaking to one another like this is not beneficial, especially during a critical time like this. It creates a hostile environment and adds more stress to the situation. EMS continued to stay in the trauma room after giving a report, which took up space that we needed. We had 2 nurses on orientation and a student nurse already extra in the room, along with the normal team members. When a code is brought in, everyone seems to always want to know what's going on or wants to help. It's important that the code leader directs unnecessary traffic out of the room as soon as possible. While the team was trying to get the patient on the monitor, everyone was working on top of each other. The charge nurse thought it would be a good idea to get the student and orientee involved. She had them putting on the heart monitor, blood pressure cuff, etc., but they were overwhelmed, didn't know how to just jump in, and it delayed the normal routine. Teaching and involving new team members is a great thing to do, but they should not be just thrown into situations. Before doing something, no matter how small it is, it should be gone over with the preceptor. This will prevent confusion and will promote efficiency. Another IV was accessed, and the team leader warned the staff that another dose of epi was due. No one could hear over the side conversations that were happening. This delayed patient care and made her very annoyed. More issues occurred too with the volume. Again, the leader could not hear the RN administering medications say, "Bicarb in and flush," which they needed to record because medications are time sensitive in cardiac arrest, and they need to know when they can administer them again. After a few more rounds of compressions and medications, a pulse was obtained. The provider ordered a stat epinephrine drip, and there was not one handy in the crash cart. The pharmacy had to be contacted to bring one upstairs, or it must be manually mixed by our staff. The quickest way to get the drip going in our case was just to mix it ourselves. To do so, the correct dosage of epi and correct diluent amount must have been known by our staff. The verbal order by the doctor was entered into the computer by the pharmacy, but the pharmacy does not see the order right away if they are not in front of their computer. Luckily, the team members on my shift knew the correct way to mix up the drip and had it hung quickly. If our staff hadn't known these ratios or the process of mixing it, then a delay in care could have happened, as well as us losing the patient's pulse again. The patient's family members were getting pretty antsy by this point. They yelled at the patient's nurse to let them back now, and unfortunately, our nurse responded back in a rude tone. This is in no way an excuse, but the nurse was just focused on getting the patient's life back, and she was exhausted. The team was cleaning up the patient and their room so that they could accommodate the family as soon as they could. After reflecting on all the problems that occurred during this code, I also recalled some positive points to remember. The team had pre-set up the room with an IV and blood tubes. This allowed for prompt blood work and the ability to establish another line very quickly. We also had a lot of hands on deck to help. We saw that this can go both ways, meaning an increase in volume, a decrease in space, but there were plenty of people ready to help right away. Our team also was able to obtain ROSC, debriefed afterwards, and the provider loudly verbalized that the volume absolutely needed to be lowered. Every one of our team members had a willingness to help and not just sit around. This is something that our staff always exemplifies. Poor collaboration with team members can result in inefficient management of human and financial resources. This was something new for me to think about, as I'm usually just trying to save the patient's life and not worrying about anything else. I realize that an enormous amount of supplies can be wasted if we are not collaborating correctly. People may be opening up extra supplies or the incorrect supplies, which cannot be used again once sterility is broken, and the hospital will financially have to eat that cost. According to an article from the CDC and Deborah Kaplan from a trade publication article, flushes have become increasingly low in supply, so we must do what we can to preserve them. In a code situation, it is important to have these readily handy, but they should not be opened until needed or by anyone who is not administering the medications. Poor collaboration can also lead to the most common thing, which is a delay in human care. Opening these extra supplies, or ones that you are uncertain of, is wasting them for the patients who actually require them. If our unit runs out, we have delayed the care for other patients because we would have had the supplies on hand if our staff hadn't already opened them, or if they would have checked with other team members to ensure they have not already done the tasks they are intending to do. There are many tips of leadership theories and strategies that I believe would benefit the goals of interdisciplinary team. However, I think that the relationship theory of leadership would be the best. Although in a code there must be a leader who directs staff, the leader must also adapt traits from the relationship theory. According to an article from West Governors University, the relationship theory suggests that listening to the concerns of the team will create a more positive work environment. When a more positive work environment is intact, employees are more likely to work together. Also, another advantage this theory has shown is that employees gain confidence in their leaders when they are listened to. If in a code situation, the employees will be more likely to listen to and respect their leader, leading to more efficient care. This type of leadership can promote a more comfortable work environment for employees to speak up about their problems that they are facing as a team if they feel they are being listened to. An interdisciplinary collaboration strategy that could help the team achieve their goals would be the change theory. This three-step theory, outlined by Akram and his colleagues, was originally composed by psychologist Kurt Lewin and suggests that a group of A group must unfreeze, change, and refreeze. The term unfreeze references to recognizing and highlighting that a change needs to occur. Rephrasing would be the team beginning to initiate that change and gaining feedback from them. Lastly, rephrasing would be taking into consideration the team's feedback and maintaining a positive work environment. After glancing at a personal situation, I was tasked to view a scenario given to me by the university, which was through Villa Health. This issue that the team members was facing was getting a new electronic health record. Most employees explained how they only had a few hours of training, were experiencing a ton of technical issues, that the corporate coach did not want to listen to their concerns, that IT was only doing the bare minimum, and that patients' care was being dramatically affected. One example of how the interdisciplinary team did not communicate effectively was when Lisa Catrone, an LPN for the company, mentioned that she was tired of people complaining about not being able to figure out the system. If she could figure it out, then so could everyone else. Lisa's coworker Nora, an RN, was very upset about the lack of help she was offering her fellow colleagues. It was making the patients suffer, be delayed in getting their medications, and then also added to the stress of trying to deal with the new computer system. If Lisa knew how to do something someone else was struggling with, she should have helped them and not complained about it. Not everyone learns at the same pace and may struggle with technology as well. Some staff began documenting on paper and having to stay past their shift to enter it all into the computer system, which is an expense to the company if they are still on the clock. This too will delay the oncoming shift's duties, as all vital signs, medications, and needs may not be updated in the chart. I believe that if Steven Silva, the hospital administrator, or Elise Wang, the director of operations, possessed a more participative leadership style, then things could have went more smoothly. West Governors University outlined this style and explained how listening to the staff's suggestions and concerns will allow them to generate the most ideal action. Everyone on the team is involved with this strategy. If this company's administrators took action like this, they could have seen that their team was truly struggling and with which exact things they were struggling with. If they could pinpoint what was the issue, they could have personally educated themselves on how to work the computer system and been of assistance when the team was having issues. They also could have been a better voice for the complaints that they did hear and address it more extremely to corporate or the coach that they had sent. Lastly, administration could have instructed employees to treat each other with more respect. The personal scenario I took part in definitely opened my eyes as to how I can improve teamwork in the future. It helped me see the different ways the Villa Health team could have communicated better as well. Management needs to be more hands-on and involved in the future and not just be focused on numbers. Numbers and employee satisfaction will improve once the staff feels listened to, is taken seriously, and is provided with the correct education.